It is a working meeting, so we're going to try our best to collect as much information as we can in the short time that we have together. I'd also like to welcome Chris Bullock beside John. If you want to introduce yourself.
I'm the president of Community Action, and we're talking about using our building, so I'm part of the team.
And then also Lorena, she's with Maryland Physicians. She will probably be joining us next week. Hello, Lorena, do you want to introduce yourself?
Sure. Thank you for the opportunity to participate. Lorena DeLeon, I'm the Senior Director of Population Health and Social Determinants for Maryland Physicians Care. Happy to be part of this and appreciate the partnership with both Chris and Shelley and John.
All right, thank you. So just a little bit of history before we get started. John and I have been working in this space from a public health perspective to reduce chronic diseases, improve nutrition security, and reduce food insecurity. So we do that in many, many different ways. And we've had the opportunity to write and win some grant awards that has brought us to this culmination today, where we're looking at opening a food bank / resource center, resiliency hub. There's a million different ways we could go about doing it. And so we're really, really excited about this partnership. Lorena is our main financial contributor with a grant that she is providing from Maryland Physicians Care. And as Chris mentioned, he has the 360 West Liberty space. And so all the work and all the partnerships have aligned to make something that, you know, Garrett County has been needing for a long, long time. So I did mention the meeting is going to be recorded, and we have a set of prompts. So there's the full house in here. There's a full house. So, and then we have several people online, but around the room, you'll see questions and prompts. And so we're going to start off the meeting by talking a little bit about the strengths of our current food network. And so there have been thousands of dollars and countless hours of volunteerism to help strengthen the food network in the county. People have been doing it for decades. And there's a lot of you that I see here today that have devoted your time and are actively involved in churches, agencies, and just other nonprofits even. And so we want to make sure that we talk a lot about what's working. Make sure that we're capturing all the resources that actually exist, and then move from there to figure out what kind of gaps still exist in the food network space and what kind of gaps that the potential of 360 West Liberty could fill. And so we're going to talk about who we want to serve. We're going to talk about how we can ensure that guests that visit 360 West Liberty are treated with dignity and respect. And as a community member, what you all can do to help sustain something like 360 West Liberty. And so we're going to basically use all of this food work, and we're going to try to create a hub, some sort of resource center that brings people together around food, but does so much more. Because we know that people that are food insecure have many other issues and needs. And so it's an opportunity for us to think a little bit broader than just a food bank. And we have a lot of opportunities to talk with our partners from around the state. Lorena's introduced us to several different people. She's doing work across the state, amazing innovation work in food. And last week I spent 3 hours at the Howard County Food Bank with the director. Fred Pulse and Chris have both been there. And there's just a lot of models and a lot of good things that we can learn from. So I feel like we have a really good basis to start this conversation. And I'm looking around and I'm encouraged from the people in the room what we're seeing. And so if we have a technical difficulty, John created a QR code. If something happens and it's like too much, we can just use that QR code and we can do all of this online on our phones. But hopefully we can use the room and kind of do it the old-fashioned way. For those online, he will put a link in the chat so you can respond to the prompts by filling that link in. or using that link to fill in those questions. And then before we actually get up, start moving around the room, we did promise we had a public comment section up. It will remain up, but at our open meetings, we will read those public comments. And so I'm going to ask John if he could start off and read the comments that have come in about this work so far.
Absolutely. Everybody probably saw a copy of the. There will also be some opportunities toward the end of the meeting. Public comments are accepted online at the Garrett County Food Bank website at garrettcountyfoodbank.com or .org. Either takes you to the same place. And there's a couple things on here. It also talks about all of the resources that we are going to be utilizing. Some of these will be temporary because we're going to be additive throughout this process. So the activities today are for today. There will be more activities in the future and opportunities to participate. All the public meeting notices are on here. Also some of the different funding discussions from the local management board, a lot of history. Things are moving pretty quickly in terms of how we have to plan and how we have to kind of solicit funding and really make sure we have all of our boxes in a row, but all of that's recorded on here for everyone. Public comment is accessible through this link here, and I will screen share for all the people online. We are still getting folks joining, which is great. So if you go to the Garrett County Food Bank website, which is garrettcountyfoodbank.com or .org, you can hit public comment right here, and there is a form that is accessible, and anyone can fill this out at any time. These will all be read at future meetings at the start of the meeting, so that way people can't come. We make sure that their voice is things, and people are still trying to join, so apologies. Okay, I'm going to stop presenting for a second. I'm going to go ahead and read the two public comments that we received. The first is from Kenny Braitman. I believe the best way to have a safe, healthy food is to grow your own. If each municipality in Garrett County and watershed, along with any residents and/or resident farmers, wanted to create, maintain several food forests with plants selected by professionals with appropriate criteria, we would be well on our way to addressing food insecurity and enlightenment issues in Hagerstown or otherwise when it's spoken. And these will also be posted. So if anybody posts these to our website, they will also be readable as well. The second comment received is from Twyla Bender. My concern does not have an easy solution. Some of our neediest folks do not have transport or the ability to drive out for the food distribution. Are there any possible delivery options? Local churches provide volunteers to deliver, ? Adding boxes to home delivered meals, ? My second thought is how to utilize food being discarded in restaurants or markets, ? Is there any opportunity for something like that? Second harvest, ? Using churches, a large food bank, a central large food bank idea, Rotary clubs, the Bridges program to distribute, ? Those are the two pieces.
I wanted to hear about that too.
Everyone, you yourself. Thank you.
Mm-hmm.
And you can mute.
I can't mute. Yep, there we go. Yeah, thank you.
So thanks for reading those comments. I did forget to introduce someone. He's very quiet over here in the room. Fred Force Jr. He is the director of the local management board and local behavioral health authority. And I will say that after Lorena and Chris and I got together and decided how this, the initial start of this was going to go, we were able to get some further funding from the local management board as startup funds. And so he's here to represent them. And then several of his staff are in the room too. You guys want to give us away. So we appreciate that financial support. And Fred is parked over here and he has volunteered to help us because we're not going to get to all of everything we need to talk about today in an hour. There's just no way. So this is very strategically a visioning session. So what that means is we're going to follow the prompts so that we can get those things done today, and then we'll keep doing this. So obviously we're on to something here, or you guys wouldn't have come out, and we're really pleased about that. And so if you have issues or if you have specific things that aren't on the wall, you can use the public comment section, but you can also talk to Fred over here in the corner about questions, ideas, or suggestions that you have, so that we can try to keep our meeting on task today. All right?
And that will be put in a parking lot.
Yes. So thank you for that, Fred. I appreciate that. And so with that, there's no particular order. There are markers setting at each kind of around the room. And, we can just kind of begin putting down your ideas. And our team will kind of come around when the sheets fill up. we'll be putting new ones up. So, don't be shy, go ahead. And John's putting the link on the, in there for people online. Yep.
Maybe have all these secret people behind.
Yes, so it is the same, the prompts that are in the room. The addition of our
Well, hey,
Good, how are you?
good.
Thanks.
Yes, that was a great conversation. Really, a lot of the smartest people in Garrett County were in the room. So,
We're gonna go ahead and mute the room. Please continue to use the chat or raise your hand, and we'll continue to monitor that for those that are remote. Thanks.
Good morning. I'm not hearing anything. Didn't this meeting start at 10?
It already started. Hey, Clint. They're doing a work session now, and I think they're going to be sharing back. So everybody's kind of on mute.
All right. Thanks, Lorena.
Of course. For those who can hear, Clint is actually our partner that does deliveries of food across Allegheny and Washington County. And he would be our partner to try to figure out how we can get some food from the Western Maryland Food Bank up to the Garrett County Food Bank. Right, Clint? You're the logistics master.
That is correct. I apologize. I'm in transit right now.
I see that. Clint was out delivering until what, 8:30 at night the other night in Allegheny through the storm. So pretty impressive.
Yeah, our windshield wiper decided it didn't want to be in the ice anymore and flew off the truck.
I don't know how you do it, man, but we really appreciate everything that you do.
It's actually my release. Like I'm an office person, okay? And driving is just relaxing, calm, easy. It's brainless work for me.
Well, be safe.
Right, for those of you online, it is a little loud in the room. We have some active discussions happening with our students, but if you can just please go ahead and fill out those questions. It looks like 7 of you have done that. Please raise your hand if you need help. We have the link in the chat, and I think Cheryl Cleary pinned it up at the top. Feel free to respond there, and we're going to come back together as a group in about 10 minutes. To kind of go over everything. And then we'll.
Hey, everyone! We have 1 second. We don't want to lose the folks online. Give us just 1 second, and we'll get back to this very, very important discussion. Go, Sean.
I just don't want to lose our folks online. We're having great conversations in the room. So looks like 7 of you have gone ahead and filled in your prompts. Cheryl DeBerry pinned it to the top of the chat. So go ahead and click that link and you guys can fill your answers in. And we're going to come back together in about 10 minutes. And be sure to, I forgot to mention, be sure to go ahead and introduce or write who you are and who you represent in the chat so we can record that since we're not here to sign it. Thank you. All right. 10 more minutes, guys.
Good morning, everybody. My name is Kim Uphold. I work for Appalachian Crossroads. I'm an employment specialist for behavior health.
Nice to meet you. I think they wanted us to put it in the chat, Kimberly, but it's definitely nice to meet you.
Okay, I didn't hear that part, so I'll do that. Thank you.
Hey everyone, we're gonna go ahead and get started again. For all of our online folks, we're just gonna get silence. So we'll go ahead and get started, and then we'll hand the floor over to Chris for community action.
All right. So what we're going to do is capture everything that's been written, just kind of go through them, read them off so that everybody in the room and online knows what's been printed here and what's come in on the response sheet online. I wanted to respond real quickly to the couple of public comments that were there when we started this meeting that John read. One is in regard to delivery. One of the things that we've been talking about from the very, we just started having this conversation in December, maybe, like, hey, is this something we could do, right? Maybe November. And one of the purposes was just that from that comment that came in about the lack of transportation, how hard it is for people to get there. Because this is a huge county, very sparsely populated. The food network is just very dispersed. And so with Community Actions Network, we deliver Meals on Wheels 5 days a week. We run our bus service all over the county. We have 6 Head Start centers. We are constantly around the county. I think the only corner of the county that isn't covered by what we do is Bloomington. And I drive through Bloomington twice a day because I live down there. So I can transport food. So we are committed to offering, like if there are 6 families in Kitzmiller that need food, we can pack up food and our Head Start folks, our Meals on Wheels folks, whoever's going that way will pick up that food and take it there so that there's a central place. And it can be dropped off at the community center in Kitzmiller and people can get there or whatever. If they're way out, you can just deliver it to their house. But there will be a delivery aspect to this. And the other comment about growing healthy food. Yes, please. Like, let's create a network of community gardens and what did he call it? A food forest. That's a great way to meet those needs. And absolutely, it's the healthy way to eat. And we're not interested in just pushing out something that's going to fill people's bellies, because there is a lot of bad food that gets pushed out. And we really want to care about people's health. Like I don't want us giving food away that I wouldn't eat, right? We just shouldn't be doing that. We need to care about people's health. And so anyway, that's my quick response to those 2 things. So we're going to just start reading these.
Yes, thank you for that. All right, so we're going to start with the strengths.
One last thing real quick. If anybody is still filling it out online, go ahead and hit submit so I can refresh here and we'll have whatever you have wrote so far. Okay, go ahead.
All right, so we're going to start with the lists, the strengths of our current food network, food resource providers. That includes churches, agencies, etc. And I just want to say that, not all of those people are represented here today. We have probably hundreds of people that work in this space. And so my job and all of our jobs is to make sure we're reaching out to the people we know who are in this, who do this, and keep inviting them to the conversation. And so we do have a food resource brochure. That's something that the Western Maryland Food Council put together. Willie was in the room, he stepped out. And I think Cheryl's online, Melissa, Boyard. So they put that together. It is on the GarrettCountyFood.com. It's where you can sign up for SNAP in all 3 states as well. So that needs to be updated. But that is one brochure that we have where there's some things. Someone's holding it up in the back of the room. That's the one. So we do have a start. We need to keep making sure all of those resources are up to date and people know how to find them. And, we can utilize that space. So just wanted to point that out before we start here. So first on the list is Meals on Wheels. This is the strength of our current food network. Home delivered, serves 200 seniors in Garrett County, groceries to go, shelf stable food boxes, serves 100 seniors per month, Learning Beyond the Classroom, 5 distribution locations, and WIC, Women, Infants, and Children program, serving 670 participants. The Episcopal Church in Garrett County has Stephen's Table, and it's in the bag. There's a food pantry at St. John's Episcopal Church, Deer Park. They're in conversation with the House of Hope, Oakland, Maryland, and I'm sorry, Deer Park is Reverend Chipley. St. Mark's Lutheran Church is the Oakland Food Pantry. Western Maryland Food Council, published the brochure and placed it in the bag, placed the brochure in the bag backpacks, update ? So we just spoke about that. Many great food growers and farmers to work with, strong farmers markets, farm stands. So that's our nutrition security. We've got strong connections with local food entities and Garrett growers, House of Hope, Sisters Marianne and Joanna. And it says, need to get a person who can tell such, I'm not sure what that says, sorry. And then Western Maryland Food collaborative effort to engage and inform cooperative efforts for the food system. So a lot of strengths, a tremendous opportunity with us in the room and our extended network. So that's a really good place to start. I'm going to kick it over to Chris to talk about something a little more challenging.
Okay, so before I do that, let me just say that it's impressive to see the full room, to know how many growers are in the county, how many people are actively doing this already, in an amazing way. Yes, go.
I have the online. So
They have more strengths.
yes, many more. We've received 11 total responses. I know there's several rooms of people. There's a lot wrote on here. I'm going to read pretty fast. We will make sure that all this information is available in the future. So under list of strengths of our current food network, what Shelley just read, offerings in lots of different areas for food banks and churches. Western Maryland Food Council has worked for years to help understand all aspects of the food system. Please use those connections and add them as a planning partner to ensure we're not missing anything. Many volunteers and community members that care. This one says, see a list of resources from the Maryland Food Bank, and it is way too long for me to read. I've already pulled it up, but we'll make sure that that's available. Maryland Food Bank, Western Maryland Food Bank Partners, Calvary Tabernacle, an accident, 27893 Garrett Highway. That's an address. I don't know what's there, but we will definitely look that up. Distribution schedule, second Thursday, 2 to 4 p.m., subject to change. To double check day and time. Oh, this is a long one. Okay, sorry. I'm just going to skip ahead here. St. Peter's the Apostle, address, distribution channel, Oak Park Church of the Brethren in Oakland, a bunch of information, Garrett College, McHenry, bunch of address and information, Ruth Baptist in Friendsville, address, bunch of information, Maryland Food Bank mobile markets, Friendsville mobile markets, information about the library's mobile markets. It's a long list. Lockwood Town Hall, that's the one at the end there, to double check. Okay. House of Hope, Divine Hope Church, Garrett County Community Action, Mount Laurel Medical, Mobile Market and Resource Exchange, it's in the bag, St. Matthew's Backpack Program, Lockland Church of God, Mountaintop Pantry, St. Paul's UNC, Senior Citizen Food Project, other meal sites, GCCA Friendsville, Christ Lutheran Church, GCCA Kidsmiller, Bethel UMC, Divine Hope Church, House of Hope, Boise United Methodist Church, Lockwood Church of God, St. Matthew's Episcopal Stephen's Table, St. Peter the Apostle, GCCA Swanton, GCCA Home Delivered Meals, Nourishing Neighbors. I'm still learning. Churches, thank you for the person who put the short one in. Churches saying Garrett College's Food Bank and other agencies provide food to people in need. Willingness to serve the community. Churches, Health Department, Mount Laurel Medical Center, Western Maryland Food Council, Nourishing Neighbors, local churches, available food pantry, and community members. Next one.
Real quick. I mean, right?
These are long.
Yeah, right. The coordination piece is becoming apparently just is glaring in all of our faces. Like, why is anyone so hungry?
Right.
What are we missing? And we have been collecting data for years through the community health assessment. We've been running focus groups since 2016, and we hear every single time about food insecurity, about people not having enough. We see it. Those of us who interact directly with clients and people who are trying to help are often so burdened and overwhelmed. My inbox is full since we started the GarrettCountyFood.com website. people are in need. They do not know where to go for help, and we can do better. We are in this room together, and we are starting out 2025 with a vision here to meet these needs. We are a small enough community, and we have clearly enough resources to get this job done.
Yeah.
So I am really excited about all of the huge long list. So go for it, Chris.
All right. So one of the things that, and Fred has seen this, Shelley's seen it, I've seen it. Who else did you say has seen the Howard County?
That's it.
That was it. Just
Yeah.
okay. So Howard County has a food bank that when you come in, you are met with kind of a case management situation. There's an intake, and it's not just about food. It's about resiliency just generally. And I think that that's going to be a really important aspect of what happens, because then there will be a central place where we're able to make referrals, and when somebody isn't able to, when they have other needs, we'll get them connected to those other needs, because all of those groups are in this room as well, right? So we'll be able to get them connected to where they need to be connected. And if the issue is simply we don't have transportation to get to the food, then we can do that, right? So anyway, what does 360? Who does 360 West Liberty serve? Community members who are food insecure or in need of community agency resources. Are there eligibility guidelines? Is this for everyone? Frequency of visit, proxy to pick up resources. Will users be pre-screened before, or will they be screened at distribution? And the idea of distribution, one of the things that we saw at Howard County that we're seeing a lot in more recently developed places is that it's designed like a store. And you get a shopping cart and you go through the store and you pick what you want. And then when you check out, they roll the cart up onto a scale because they keep track of it by weight, not by dollars or whatever. It's all by weight. So then they bag it and go. But you're shopping, right? And it's a whole different model than a lot of us are used to.
It's called a client choice model. And there's several different ways to do client choice model, but it does help people. It raises the dignity up, and it gives people an opportunity to get what they want and what they need and what their family's going to eat, not what we think they need.
Right. One of the things that happens through our food distribution with our seniors, we have the 100 boxes to go every month, and we have a wonderful team of volunteers that both come and pack it and then deliver it. It's wonderful. But a lot of the feedback we get from the people who receive that is that they could build a castle out of all the dry beans that they have, because every month they get another 2-pound bag of dried beans, and so they're waiting for a flood to happen so they can, use them for sandbags.
In my defense.
Can I speak for a second?
Yeah, can Shelley and Chris I think Clint and I both have some stuff to add, given the fact that, we actually have successful programs now in what was it, like 5 counties. And I would encourage that if you happen to be in Baltimore to look at the model that's been created in the Food Project, as well as CAN. CAN does a really good job of having that kind of feel where you walk in and do that shopping. But Clint is our resident expert when it comes to ensuring that no food goes to waste. He's the one who is manning the program both in Washington County and Allegheny for MPC. So Clint, maybe you could share a little bit about your choice program, because I think it's an amazing model and something that we may want to consider for the food bank.
Thank you, Lorena. So we figured out a long time ago that just putting stuff together in a box and sending it out to people was not only a waste of food that people aren't using, but it's also a waste of our precious funds. Because people were just taking that food, and as soon as we have a food bank or something, or a food drive or something, we'd get all that food back. And that was the only way we were finding out what people weren't eating.
So what we did is we created a very simple online Google form that can be easily emailed, texted, or whatever to people so that they can fill out and choose how many items they want. I mean, what items they want and what meat items they want. And then we can put it into a spreadsheet that Google automatically creates and put the orders together. And the best part about the Google form is that it tracks the percentages of how often somebody picks those items that are available. So you can see in there, black and white, exactly the percentages that people are getting beans or rice or whatever they're choosing. So that next time when you make a food order, you're not ordering something that 56% of your population doesn't want to eat. You know, it's very simple processes. I can show anybody how to do this. You could have your high school kids doing this. It's easy. There's no reason for us to be wasting money and sending out food that people don't want to eat, or stocking our shelves with food that people don't want to eat. You guys laugh about it, but it's not funny. It's a waste of money.
Yeah. Thank you, Clint and Lorena. Like, we don't have to recreate anything.
Right.
We're just gonna do what works. We're gonna lean on our partners, our collaborators, and we're gonna do that.
And that was
Sorry, I didn't mean to digress. I just thought it was important because there are some models already out there that we can just replicate and move quickly. So thank you for your leadership, Shelley and Chris. And sorry I couldn't be there with you.
no worries.
You are here.
So this next statement on the 360 says, how do we teach track data to demonstrate need, intakes, demographics captured? And part of that is just what Clint had to say, you know, that a lot of that is just happening naturally. And then the possibility of resources for specialty diets, gluten-free, dairy-free. Those are important things too, because there are a whole lot of people that are food insecure who have to eat what they have to eat, but it makes them sick. And so if we can do that, that'd be great.
These thankfully were a little bit shorter. So as we go, people got their words out. So people who don't qualify for food stamps or who don't get enough food stamps for their family's needs, food insecure agencies, local farms, the hope would be that anyone in need will have a place to go and get help. Alice population, all of Garrett County. More people than you think, exclamation point. Anyone in need? No clue. Everyone who needs it, needs it covered.
So in a perfect world, we treat everybody without any strings attached, right? No questions asked. But we have funding, restrictions, we've got all sorts of hoops to jump through depending on where our resources come from. And so I think the main goal is to understand what kind of food insecurity we're talking about in Garrett County. We've been working on quantifying what food insecurity means and what it looks like. Locally, we've got a lot of data, nationally, statewide, not so much just local data. So many of you have heard about Divine Hope. It's on the positive list. Ron DeWitt runs that soup kitchen. He couldn't be here this morning because he's literally building right now, as we speak, a section out to store food from donations and things that they get. They served over 800 people at Thanksgiving. And so he has a group on mygarrettcounty.com that he submits data to and keeps track, and he puts that out. I'm hoping that other people will do the same. You can join that at any time so that we have an idea. The number, unfortunately, keeps ticking up. And it, of course, fluctuates around the seasons. And so we need to work together to get a better understanding of what it looks like when it happens, so that we can better tailor the services that we have. So thanks for reading that. The next question is, how can we ensure guests are treated with dignity? So some of the answers are possible training of staff. In parentheses, it says sensitivity training, etc. Greet everyone with a warm smile and a friendly greeting. Create a warm and welcoming atmosphere. Hiring the right staff, continuous training, community outreach, and representatives from community agencies to share resources. Those are all great suggestions. And online,
online, we got some longer comments here. So staff should welcome all people with a smile, assist persons with disabilities to get what they need, have apps on the staff phones for text to speech for hearing impaired folks, use compassion no matter what the person looks like or acts like. If there are limits to what each person can take, perhaps pre-box those items so people can easily take what they are allowed. Everyone will be treated with respect and provided an opportunity to thrive. Avoid pre-packed boxes, bags of food, and allow neighbors to choose what types, amounts of food are right for them and their families. This brings dignity and prevents food waste. Ideally, you would set it up like a mini grocery store, best practice, and a link to the best practice. No judgment. Provide good training to the staff. Allow guests to select their own food. This is how staying at Garrett College is set up. I did not know that. Kindness matters, proper training, exclamation, exclamation, exclamation. The form in which screening is conducted, and training and education of program staff.
Thank you. Thank you online, folks. That's really helpful. We do have on the GarrettCountyFood.com website that we are continuing to build out. There's a few resources, books, and just best practices that talk a lot about dignity and talk a lot about models. There's evidence-based programming, and through the local management board funding, they have agreed to pay for some of that initial training for our frontline staff to help ensure that people are treated with respect. Tom?
Yeah, you mentioned about some restrictions using the funds, things that you could do. Could you publish those so we don't plan on using something that they won't approve?
So it's going to change. So like Lorena, for example, maybe Lorena, you could pop on and talk a little bit about some of your grant requirements.
Yeah. So, I'm sorry. We did a $25,000 donation to do the startup costs for the location, and Chris and I actually walked through, and Chris pointed out that there needs to be some changes to a wall, and Chris, you might have to help me out here so that you can at least get a pallet through, right? But for MPC members specifically, for ongoing support, MPC is reimbursing anybody who gets referred to the food bank, is providing a reimbursement for those who have a social risk score of greater than 75 and have a food insecurity as their primary need. So we have eligibility criteria for that. And we have funding that's been set aside to be able to support the program. Additionally, some of us are working on some grants, and that's something that Shelley, myself, and Chris are looking at, are some additional grants that we could drive to continue to support of the food bank. So, I mean, our hope is that other payers will come to the table, and we will be willing to provide reimbursement and funding so that we have ongoing funding support years to come. But I think having the initial funding was the key. Keep me honest here, Shelley, which was missing to at least get this operation up and going. And I think we've provided that infrastructure now.
Thank you. I would agree with everything. So nothing is free. I mean, I wish it were, but every single grant that we get in this building has a requirement, because we have some accountability to who's giving the money. And everybody has an agenda, and everybody has a certain thing that they are wanting to address. And so the beauty and the hardship of a grant writer is to balance all of those things. And the deal is you try to put as much in the bucket as you can, and you try to work with funders that are don't have as many restrictions. And so far, Lorena, she's been amazing. And I've been working at this this is our 5th year. And we've had hoop after hoop to jump through. She's the first one who's come to the table and made this happen. And so even with her restriction, it's the least restrictive we've come to so far. So I can't exactly do what you're asking me to do, Tom, but I will try my best to ensure that everybody understands what the streams are. Yeah.
That's what I'm trying to.
And just for clarification, Shelley, this is a team effort. I couldn't do it without our CEO, really putting focus on Garrett County and valuing, the needs of Garrett County. So please understand, this is not a one-man show. It took a lot of people, buying into it and putting, the needs of Garrett County before anything else. So.
And we will be publishing a lot of information. So there's two websites to watch. GarrettCountyFood.com, which is the totality of the Food Network. That has all of the programs that we currently know of that exist. It has all the food brochure information. It has information about enrolling in WIC. Get to see Caroline. It has SNAP enrollment. There's several ways you can enroll in SNAP. So all of that is on GarrettCountyFood.com. The second website is what we're discussing today, which is GarrettCountyFoodBank.com, specific to this effort to create this centralized location and all of the different aspects that go along with that. Chris has mentioned many, but along with that, we'll be publishing, here's the funders. So for example, you can actually read what the local management board approved, the actual funding plan, all of that is on that website. So as each piece of this comes together, each grant, each funder, all of that will be posted there so that we can better understand how we can braid all of these systems to serve as many people as possible, whether they are an NPC patient or whether they're from a different background or if they're just someone in need, whatever we have in terms of supplemental funds. So that is the longer term goal, but everything we have, every single step is being posted there, and anyone at all can see that.
When they come in. And then there's some historical information on the GarrettCountyFood.com website about the Appalachian Farm and Food Alliance. We've got some fine money that came in a couple of years ago. So all of the mobile markets and all the things that we had done, it's there. So everyone can kind of read about what has happened, and we'll just keep putting information out as we get it. And then if you guys find information, you see grants, you see opportunities, you have someone that wants to donate, Chris is always available through the nonprofit to take a donation. And so that's another arm that we haven't started developing yet. Of course, it will be an essential one for the sustainability of this food bank. All right, let's get back to our question.
All right. So quickly, as a community member, what can you do to help sustain 360 West Liberty? Hands-on volunteer as needed, LBTC designate funds or support from the Judy Center. Fundraising activities, keep it in the conversation at agency meetings, volunteer, donations, volunteer, help ID funding opportunities, church teams of volunteers, and local foods. Absolutely. What do you have?
Yes, and whoever wrote LBTC, please make sure you explain acronyms because we have an acronym soup. So, as a community member, what can you do to help sustain? Help source locally produced foods, help make connections with other food council partners, help with grant letters of support. Always an important factor. Volunteer, mentor, fundraise. As a Maryland Food Bank representative, I would be interested in learning if you're willing to partner. Assist in contacting the right people when the food is running low. As a community service provider, I will be referring clients to you. Volunteer my time, share information. When I know what it is, I will be able to answer this question. That's always important. Donate, volunteer, allowed to be involved. It's a really important point. And I think by participation we have in this room, this is a really good first step. Provide information to bring awareness of this resource. Back to Chris.
Thank you. And these letting people know what the needs are. Some friends of mine, I used to run a homeless shelter in West Virginia, and it's not doing the same kind of work that it was doing back then. And so a couple of local churches have picked up the ball, and Clarksburg Baptist is housing 25 to 30 people every night, and they need resources, and they put that out on Facebook 3 days ago, and yesterday they had to put out, please stop giving. So that's, that's an amazing thing.
Chris, before you continue, LBTC is Learning Beyond the Classroom. That's the bus that goes around in the community to do outreach to underserved communities with students and grandparents and care providers.
That's wonderful. That is a great
I've been on the bus many times. I just didn't know that that's what it meant.
Besides food, what other services should be offered at 360 West Liberty? Transportation delivery, talked about that. Identify all food providers, organizations to avoid duplicating services. Absolutely. Provider information services offered in the community. nutrition education, family goal setting. That's something that we've talked about. That's something that we do at Community Action through our 2-Gen work with, that is primarily through Head Start, but we piloted that through with families with older children this year. And as we began talking about this process, I said, you know, doing the life scale assessment with people that come in for food insecurity would probably be really helpful. And a lot of those folks would want to do that. How can you help my family over time rather than just this time, so that it becomes relational rather than transactional? We really want people who come to be served to eventually become partners and volunteers and part of a community, because I really believe the community is what heals people, and where we find what we need through each other. So we want this to become that. And I'll talk about something else in that regard. Basic gardening skills, yes. Veggie containers gardening. Also on package, not sure what that is. Hopefully we'll figure it out and it will be published.
I think
Canning
it
and
says
preserving.
parking lot.
What is that?
I think it says parking lot.
Also on parking.
Oh, on parking lot, thank you. Canning and preserving, yes. Meal planning and prep workshops. Repository, thank you, repository for local gardeners, to contribute surplus. That's a great idea. Cooking lessons. One of the things that facility comes with is a space that used to be a commercial kitchen. And we plan on restoring that and creating a space where people can have, where there can be classes and people can learn how to cook. And we really would like there to be a little kind of cafe with sit have cups of coffee together. Because I think that, you know, if I want to go out for coffee with somebody, I can just do that, but a lot of people can't. Yeah. And I think when I need to have coffee with a friend, I really need to have coffee with a friend. And other people have those needs as well. It's not just about coffee, right? So like my son who's very poor gave me a birthday card the other day to have $5 in it, so that dad would go get a cup of coffee because he knows it's life and healing to me. Anyway, go ahead.
John, any comments on that?
We sure do. And Chris, Samantha has a question in the chat for you.
Oh.
She wants your contact information.
Oh.
So can you go over that one more time?
Yeah, so can you put my QR code up on, or is that possible?
Probably not while I'm recording now.
Okay.
While we're
I'll
getting
read.
that,
Yeah, I'll read yes. So Samantha, Chris will get with you and make sure you have all his contact information. Besides food, what other services should be offered at 360 West Liberty? Cleaning supplies and hygiene products, diapers, wipes, resources for emergency housing, childcare during the appointment, health department and Mountain Laurel resources for affordable health care, list of the food resources / pantries, something I'm proud of. We at the Western Maryland Food Council originally created this. That's been talked about a lot today and has been updated repeatedly throughout the years. It's certainly a vital resource. Maternal and infant support, nutritional education, vital records support, workforce development, financial and health literacy assistance. Partner with GCCA services, ? Medicaid, AHEC West, Community Action Services, DHS services, homeless services, peer support for substance use, case management ! The Possibility Shop in Cumberland provides a great model for that. Fuel vouchers, ? Anything that helps address needs of individuals using it, hygiene, laundry, baby food, pet food, and healthy options. And just one last comment. So as we continue to put more and more opportunities for feedback, please explain all the acronyms because these will be posted without context.
Thank
you.
And so just a few other things. Chris mentioned there is a commercial kitchen. I mean, there's a stove. And it is, you know, it has good bones. And so the site needs a little love and it needs brought up. And so we've been talking about this, I don't know. It's maybe late November is when we started. I don't remember when the first meeting was, but in that short amount of time, we have a restaurateur who is donating a kitchen designer to us. Who's coming in, I'm meeting them Sunday evening, and gonna take, measurements, go through the space. And so we have some incredible talent being donated to us Sunday, to talk a little bit about that. And then in the space as well, there's a bathroom, like a place for 2 separate bathrooms, shower facility. We talked a little bit about, there's a place for a washer and dryer. So we're really looking at, some like meeting needs across all the needs. So people can perhaps do their laundry, people can bathe, there's hygiene things. And so it's really, the sky's the limit here. And so it really does depend on how much money we can gather and what we can start doing, but it has good bones.
Do you have a projected estimate of yearly costs?
We do not.
Okay.
Nope. We do not, because this is the visioning. So what's possible? And we have to work with what we have. So we're not going to spend money we don't have, but we're going to try to understand what the need is and what we can immediately do with the money we have. And then this will be an iterative building on type of project.
And we also have a couple of years of other programs that will continue to operate simultaneously. This is really, the catalyst came together, Chris came together, all of these pieces, the years of work that we have been working on trying to materialize this into a permanent facility. We have other plans as well that will continue as well. So if you look at the GarrettCountyFood.com website, you can see programs that will continue to operate. There's just many things that will continue to exist for probably at least the next year or two, because those have already been submitted. Many of those grants are already under development or already implemented. So that's just an important note. This is really the timing of all the stars aligning for this to be able to happen. So we are capitalizing on the opportunity.
So this is the last question. What gaps in the food network can 360 West Liberty fill? So is a community garden possible? I think we've got a few gardeners in the room here, growers, so I think yes. I hope so. Demos and supplies for teaching how to can and preserve foods. Demos for preparing meals with foods. Provide recipes with uncommon items to encourage use, as well as cooking demonstrations using healthy food. Is the farm community involved?
And logistics.
Thank you. And logistics.
Thank you.
What did you say, Brett? Is the farm community involved
in logistics of this program?
Okay. Local food production into local food bank, northern end of Garrett County, and consistent supply of food for those in need.
I think we have a couple more online here, and then there's just a couple in the parking lot for the next one as well. So people need food immediately, more timely access. I think it could serve as a hub for food bank deliveries / pickups, locally produced food pickups / deliveries, and a staging area for pantry deliveries. Centralized hub to store staples and services that could be distributed across Garrett County. So also a major theme we're seeing. Being open to the public on the weekend or in the evening would help people who need food but work traditional 9 to 5 hours. Food stamps enter usually at the beginning of the month, so any food towards the last few days of the month would be amazing. Needs of homeless, assistance when food stamps aren't enough. 360 West Liberty could have more available hours than the churches, could serve as a resource hub, both the physical building and online, could provide fresh produce, dairy, and meat in addition to canned / boxed foods. Availability of food pickup during non-working hours, evenings, in parentheses. Need to collaborate to see what the needs are, could fill the gap at the end of the month needs after SNAP benefits run out. Folks who do not have SNAP and are on the cliff and do not qualify but can't afford. Consistency, geographic location, distance between service providers and residents.
Thank you, guys. Anything to say that I might have forgotten about the questions, Chris?
I don't think so. I think the only thing that is in my mind at the moment is anyone who feels like they've not been part of the conversation early enough. This is as early, like we are, this is the conversation number one. Up till now, it's just been a few people kind of dreaming and visioning about it, and you know, this was the first opportunity we've had to get everybody in the room to begin talking more robustly about it. So I am incredibly grateful to see the interest. I think we had 22 online, and I'm not sure how many are in the room, but that's an amazing turnout. So obviously our strength is that there are a ton of people in this county who care about people who are food insecure, and standing together, pooling our resources, we can meet this need and overcome that for people who are on the edge.
Thank you. So we're gonna take a minute and read our parking lot and other questions or ideas or suggestions. So this says, how would you like to collaborate with local food pantries? Who will maintain the actual parking lot and building maintenance? Outreach to food suppliers, grocery stores, restaurants, caterers. Where will foods be collected? Where will the foods be collected, stored? And what other than parking lot will be used and located in Garrett County? Cold or frozen items taken, coordination with other agencies and organizations, the Maryland Food Bank connection and coordination, more funding to butchers for farmers' deer program, feeding the hungry. And then on the side here, it says Google Forms.
That was from the guy.
Chip.
Chip.
The online ordering and food, to keep track of the food selected. Thank you for that, Fred. And do we have any parking lot issues online?
We had 4 parking lot issues that were submitted online. Post hours widely. Have an active social media presence, as you always do, to get the word out when there is food available, and manage expectations, exclamation point. Starting a grant workshop might be a good idea to ensure we are applying for a continued source of funding for support services. Definitely agree with that. Work together on all agencies to be efficient. What is the process to access? Question mark. Are proxy options available? Question mark.
Thank you. So
That is everything online.
we do have a grant curator in the room with us. That's another one of John's jobs. So on mygarrettcounty.com, he basically sends out any available funding. You can sign up for that. You can join the group and you get those automatically in your inbox. So if you've never written a grant, just try. It's not that big a deal. And you might, get an award. So we're obviously available to help you. There's also the community needs assessment. I mentioned it at the beginning. It is just published. We published it Wednesday of this week. And thank you. That's the action group. So you can join mygarrettcounty.com, set up an account, get logged in. But the assessment has every piece of data you could possibly imagine. We have zip code level data this year for the first time ever. So that's to write your grants. And, so we continue to try to just put together information and resources for our community to benefit from. And
Do you want to show them where the assessment is?
go for it.
Okay, so if you go to mygarrettcounty.com under My Community, if you go all the way down, you can see the 2025 through 2027 assessment. This is just hot off the presses this week. It is 3,000 pages of painstaking labor, so please use it. It is there's a lot of stuff here, but it's all broken down for everyone. And you can also go back for previous years. So if you're interested in how Garrett County changes over time, that is there. And if you're writing grants, there is actually a really cool tool over on the right where you can build custom reports. So you can build those custom reports that, again, also showcase some of the year-over-year change of the internet cooperating with us. Yes. So you can see over time how food has become more of a priority.
All right. Any questions about any of those things? Resources? Yeah, Tom.
It's really great to hear all these great ideas. So many people involved in this is such an important thing. But I'm concerned because you got a $408,000 distribution for this year. Is that right? Through AHAC.
So AHAC is a separate grant.
I understand. They gave you 400. $408,000, is that correct?
No.
Being distributed among the 3 or 4 sub-grantees.
So Melissa Clark can speak to that grant.
Sure.
Myself, our unit did not get $400,000.
The money was distributed to Garrett County, and there are 4 sub-grantees that's distributed. And yours is about $118,000, is that correct?
It's approximately that.
Okay. Now, how are you going to prioritize those in terms of the money you got for this particular year?
So we are in the process of building out different funding forms so that
Right.
people can respond to those things. We did a food distribution around Christmas time, and because this just came to fruition, we have yet to get everybody around the table as far as decision makers and kind of have some of those discussions. So that's probably a next step.
But I'm saying within this particular fiscal year, how will you meet the needs? Or will you prioritize them? It's what you're going to do this year. And then hopefully in the next year, you can carry it over. Because it says it here that the Garrett County Health Department will expand access to food, offer peer support services, exercise classes, cardiac health interventions, establish the Garrett Guide, hire a PRS, and assist with data analysis. And Allegheny County Health Department will train clinical staff to administer. That's what you're in between.
Yeah, so we're doing those things currently.
Right. But
And I can talk a little bit about that too.
Sure.
So that is what I just addressed earlier. So we have some programming that before the food bank is fully operational, will continue to meet emergent needs. So in the first food distribution, we sold out within less than 3 hours. Our list, because people can actually put their email in to be notified when future food distributions are available. We are up over 400 people that are already on that. That program is just soft launched. We haven't even fully launched that yet. We've been building infrastructure because a key piece of that grant is really chronic disease prevention, which is broader than food. So a lot of it's physical activity. We're paying for yoga classes, pickleball. There's a whole bunch of investments that Shelly's been making on that side of the house because we already had some of that infrastructure in place. All of the food work is really kind of being reconstructed. We've had smaller grants that we've done with the Harvest Hub. We partner with some of the farmers to do different outreach activities in remote communities. And the other important part of that grant is at the moment, it is still a remote communities grant in Garrett County. It's not an Oakland grant. So there's several pieces of work that will follow with that. There's not, to my knowledge, and Shelley can correct me if I'm wrong, for this fiscal year, we are going to continue to meet the needs that were originally identified for that funding source. It's going to take a little bit of time for us to really figure out what support the food bank needs. I think a lot of that is actually going to be continued grant development. And that's where that group is. I post grants almost every single workday, sometimes even on the weekends. And I would say probably 99% of the grants that I post that Garrett County, either agencies or organizations or nonprofits are eligible for, do not even get applied for. And that's really one of the root problems, I think, is that we just do not have broad capacity for grant development in the county, particularly at individual nonprofits or agencies. And like, we don't have the ability to just write because the people who write the grants oftentimes then have to implement the grants, which is where we have found ourselves at the moment because like I'm a data person and I'm sending in a food meeting. So, that's kind of where we end up, right? So the money follows that. But I think for this particular effort, while that will support food insecurity, I think that at least at the moment, that has a different focus. The focus of that is really getting resources out. Because in Oakland, like we have a whole map on GarrettCountyFood.com, and I can pull that up and share that link with folks. But you can see that we have a huge, right here under food resources. So the brochure is on there, and then there's a map that has most of the information from the brochure. It's hard to figure out where all my food council folks are, but that brochure is in there. There's also all the application information for SNAP and for WIC for Maryland and for West Virginia. The Pennsylvania is still a little bit complicated. But you can actually go in this map and you can zoom in and you can see, okay, so we have some resources that are up towards Grantsville. We got a couple things at the lake, a couple things in Oakland. So we're really focusing at the moment for the first distribution on Friendsville because there's just not a lot there. In Oakland, we have huge churches. There's still other churches in other communities doing it, but at very large scale, particularly in Oakland. It's also where there's a lot of walkability for affordable housing. All kinds of different factors are contributing to that. But we will definitely be posting a lot more. I think that the HERC, at least in my mind, is really focused on the application that we submitted. It is very much a health grant at the moment, but food is where we are seeing the huge need. So we're trying to address that as best we can within the confines of what that grant is, because our arm is really chronic disease prevention. So if we're able to serve food through that, that's great. But I think that what we really need to do in the longer term, we had this fantastic investment by Lorena, by the local management board. Shelley and I have already submitted several other grants to fund the food bank. It is the specific line item in those grants. And I think that that is where we're going to continue to look. So anytime a grant allows not for capital infrastructure, because that was what was really holding us up over the last couple of years, we can't buy buildings, right? That's usually excluded from most applications. But what we have been doing is we've been writing in these yearly grants. So we submitted a 3-year grant, we've submitted some 5-year grants. And in those grants, each year we are writing in a specific amount of dollars, if approved, that can then be directly invested into a food bank once it exists. We've already submitted the grants, hoping the pieces came together. So what is that?
I assume that what you're saying is you have collateral sources that you're going to be relying on to carry out some of these objectives.
Yes.
Okay.
Yeah.
John, and maybe I can add to that. I mean, I could tell you right now that, MPC has committed to having a community health worker being on site, a couple times a week to make sure that we're coordinating resources, so that we can continue to advocate to bring money to the local community to support, the food bank. Additionally, I have a health educator that will spend time drafting grants, and applying for grants. As a matter of fact, we're already in conversations about a $75,000 grant that would bring funding over the next 18 months, so, please know that this isn't an effort only, from, we're not putting all the effort on the health department or on Chris. We're going to continue to try to figure out what are additional funding sources that we can bring to the table. The other thing is, once we've got an established location, even though we're a Medicaid only plan, there is funding through Medicare that we could look at to bring in. But part of this is getting the infrastructure built. And what has happened over the last 6 weeks is incredible. And I think we need to give Shelley and Chris and John, a hand here, because none of this would be happening. So, part of it is just getting an infrastructure and then figuring out, okay, what else is needed at the table. So we've made tremendous progress in 6 weeks. And I don't want to take away from that, but please know that we're committed to being a longstanding partner in the community as well. I hope that helps.
It would just be a real shame to lose all these good ideas for lack of money. And so it's excellent. I have one final question in terms of providers. What part does the farming community play in this distribution?
So I think that that's a really important question that we've seen on several different things. We've got some of our great farmers in the room today, all over the place and online as well, I've noticed. And I think that that is going to be a question that we probably have to address a little bit later, because the health department will not be a procurer of food for a food bank. What we can do is we can write the food bank into grants, but it would be too logistically challenging for us and our documentation purposes to pay for individual food items and then transfer them to another agency. I would not do that to our fiscal team, because I would probably get run down in the parking lot with great folks, but that would be terrible. So what we are doing in the grants that we are writing is we are writing in specific dollar amounts to be given to a food bank entity. So whoever qualifies under a true food bank, then we can do that. And we can do our regular requisitioning process and all of the fantastic paperwork that you also get in those daily emails from me that we send out regularly. But the other thing I also want to mention is that, we already have the investments to get this off the ground. We've already paid for all the websites. So all this stuff will be posted and it will be there for quite some time. So I went in and I purchased all of that. Like that will be there for a long time. So hopefully within the next 5 to 10 years, we can figure out how to sustain this and how to make this a long-lasting program. But we wrote this into quite a few grants. What we really need is we need a stronger network of partners that can also do that, because we can't write a food bank into every single grant that we submit. And I think that that's an important conversation that needs to happen, is how do you fund this and how do you fund all of these other services? Because what Chris talked about, all of these really key needs, and Shelley did as well, and they wrote on the boards, right? So we know that we have a homeless population. What are we doing? Like that's a really valid question, right? So how are we making sure that they have access to hygiene, that they have access to a warm place, right? So we have, for the first time, some sort of warming thing happening. Gotta be careful with the language on that. But there's a lot of pieces in motion. And I think if we can come up with what the vision looks like for this, we can start writing it into grants. Hopefully other agencies can write it into their grants, and we can figure out a longer term support system. But you know, we've had this idea for a long time, but if there's no infrastructure, you can't apply for grants for infrastructure that doesn't exist. Like, we had to demonstrate that there will be something in order to actually apply for the grants to fund it. And there's a lot of money out there. I think that there's a little bit of a misconception because we want money to do really specific things. But there's a lot of programs that you can write food security into that may not necessarily just be food security. Like, with our fantastic partners at AHEC, I know Missy had to hop off there, but they have done everything possible to try to help us meet that need. Because in our assessment efforts and in our surveys, we were like, okay, this says chronic disease, but food is our one of our biggest problems, right? Like, people are hungry, that just blows all of our other things apart. So I think if we can continue to have those partnerships and have these discussions, like, I feel like I spend an inordinate amount of time in food, but it's where there's momentum, it's where there's funding, and it's what we need to do because we have the opportunity to do it now. And if we wait, that could change. And I think that's a really important consideration.
Well, I appreciate what you said there. I'll get in touch with you. We'll talk about the activity because I think it's a very important component.
Yes.
And one final thing, this gentleman is absolutely awesome to work with. He's absolutely amazing. I'd like to acknowledge it because I worked with him before.
Thank you. I appreciate that. And also, I forgot one of my points all day. I want to go back to that too. We are working on other applications for other funding as well so that we can continue to do local sourcing. So that's still something we want to do with health department programs. It's just we will not be the sourcer for the food gang.
Thank you. Appreciate the clarification.
I think we have to kind of wrap up because we have another meeting starting in here at 11:30. But the next meeting will probably be on our at 360 West Liberty. So you know, that more to come. So I really appreciate everyone coming out today, and thank you for all of your time. The public comment stuff will be open. Please pass it along. Keep talking about this, and we'll keep working together. So have a great day.
Leave us. All right.
Oh,